World Cancer Day. It's an international campaign hosted by the International Cancer Control. And it's the whole morning, basically, we've been discovering different aspects of the disease, including awareness on gender cancer, especially breast, prostate, testicular and cervical, which are the highest mortality cases and cancer killers globally. Well, let's cross over to Ayanda now. She's been following it the entire morning out at the Baragwanath taxi rank. That's where she's stationed. In fact, this is around 9 taxi ranks around South Africa. Would you say it's been a success there, Ayanda, I can see you creating a buzz, but what about the commuters? How are they feeling about all of this?
Leanna, very good morning to you. I would say it's been a huge success. I mean, the number of people who have come here, some who were just going about their daily activities, going to work, going to school, have stopped and have checked and have picked up leaflets and pamphlets and have asked about where else they can go. Because although this is a one-day activation here at the Baragwanath taxi rank, just a stone's throw away from here at the hospital, there is a whole unit that's dedicated to breast cancer and to other cancers as well, detection and screening and the treatment thereof, Leanne. And I'm going to be speaking to those foot soldiers, those men and women who dedicate their time and their efforts towards this cause over and above just today. And one of them is Dr Cubasch. He's the doctor who's the head of the unit here. It's called the Batho Pele breast unit. A very good morning to you, Doc. Thank you so much for joining us.
Thank you. Good morning. It's nice to be here with you.
You must be excited about today's activation.
Look, our life is not only excitement. Our life is actually being at the call front, and I find it great to be here, like close to the transport business. And what we're having in common is like service delivery on a daily basis. So sunshine or rain, you can rely that there's a doctor at the Batho Pele breast unit who will assess you and he will attend you without delay and without, queues exist. But everybody who comes to the unit will be seen with referral letter, with self-referral, and we have no waiting time for cancer surgery, so we in real time deliver. Same like the taxi industry.
Would you say that there's a great need for your unit, not only in South Africa, but here in Soweto in particular?
Look, our numbers speak for themselves, and we are dealing on an annual basis with about 350 newly diagnosed breast cancer patients. And breast cancer is not like a once-off diagnosis and then you move on, but it is complex, and medically it is complex. And the times are over then when you as a surgeon would cut the cancer out and the patient is dealt with. Not at all, but it is now multimodality treatment. We are dealing with lots of our colleagues, with medical oncologists, radiation oncologists, pathologists, radiologists. There are a lot of very critical role players, and for each and every patient you have a highly complex and sophisticated system that needs to run smoothly, and we are doing it sunshine or rain, as I said. Power failure, no power failure, and sometimes power failure really makes it difficult for us.
I can imagine, and you spoke to me a little bit off air about some of your challenges, power being one of those, and I loved what you had to say. You said, when you look at the health system holistically, sometimes it can be quite serious, but it's not hopeless. And that's the attitude that I loved with which you tackled your work, saying that there's a great need and sometimes things don't work as well as they should, but you are hopeful that things can change and your success stories speak for themselves. And I'm going to bring in now the MEC for Transport here in Gauteng, Mr. Ismail Vadi, to ask him, transport meeting health, that's a rare combination. MEC, good morning and welcome. What are you doing here today?
Good morning. I'm here to support the campaign. I think it's a wonderful partnership between Santaco and the taxi industry, Pink Drive and the hospital, as we just heard. Taxi ranks are areas of mass transit, so large numbers of people moving in and out on a daily basis, and it's an ideal point to launch an awareness campaign. Today is International Cancer Awareness Day, and I think it's a wonderful gesture on the part of the organizations to come here to educate ordinary members of the public and to really alert them to the importance of having pre-testing, advanced detection, so that you can take remedial action.
Mr. Cubasch, speaking to us a little bit earlier, said they're trying to make sure that it's business unusual in the taxi industry. So if they can raise campaigns, raise awareness on a number of initiatives, and not just World Cancer Day, but perhaps diabetes and other illnesses, and perhaps money-related issues of how to take care of your finances. So basically saying that they want to use this platform of transportation for greater social awareness and intervention. Is that sort of the angle that you're going towards?
I think that's a very good gesture on their part. They've got to go beyond just the business itself and just moving people, sometimes not very safely either. So it's good that they broaden the horizons. Broader social issues are important. There's the anti-drug campaign, there's anti-crime campaign, there's all sorts of social needs out there. And if the taxi industry becomes a positive player, a proactive player, I think they reach people daily, but more than we reach them actually as politicians or as government. So I think it's a wonderful initiative on their part, and I hope that we're going to see more of these kinds of activations on a wider range of social issues.
Love it. A number of stakeholders who are here include doctors, include volunteers, include some of the workers at Batho Pele. So I'm going to ask them to say goodbye to us because they're all here and they've all come in their numbers. And by the way, they call Dr. Cubasch Papa, they call him Daddy. They say he's the father of the unit there because he just goes out of his way to teach them and to serve and to give. So I'm going to ask you guys to say goodbye from Paraguana to Boris. That's all, at least for now. It's back to you in studio.